Welcome back to HealthWise. I'm here with Dr. Jason Hatfield, and we were talking earlier about high blood pressure and, you know, the frequency among different people, whether it's men, women, and he said that it was mostly genetic. But Doc, once they come into the office and you diagnose them with high blood pressure, then what? You know?
Well, as we alluded to earlier, we start talking about treatment, and there are multiple ways to approach that, and it's somewhat based on the actual numbers that you're looking at. For example, if I'm seeing someone relatively young in their 30s, 40s, even early 50s, their blood pressure is running somewhere between 140, 150, maybe even 160 systolic. And this is a relatively new occurrence, maybe not a strong family history, then we may just consider what we call lifestyle modification, looking at dietary changes, reducing salt intake, caffeine intake, caloric intake even, reducing how much they eat, and then exercise. We know not only that exercise is beneficial cardiovascularly for the health of the heart, but it also has a direct effect on reducing blood pressure. And that can be something as simple as 20 to 30 minutes of brisk walking, aerobic exercise 4 to 5 times a week. We can see gains up to 5 to 10 points in that blood pressure drop just from exercise. Same can be said of weight loss. Losing 10% of body weight can drop that blood pressure somewhere between 5 and 10 points. So depending on the individual, depending on how successful they are, just from the lifestyle changes we'd like everyone to make anyway, you can see that reduction in blood pressure back to the normal range. Having said that, that's probably not the norm. We wish it was, but all of us are guilty of overindulging here and there, myself included. So you start to look at medications, and that's a bad word sometimes with people. No one ever wants to be on a medication, and honestly, we don't want to put people on them, but unfortunately, the risks of continued high blood pressure outweigh the harms that we may get from some blood pressure medications. So if diet and exercise fails over a course of 3 to 6 months, then we're talking about medications. A lot of people can get by with 1 drug. Most people require 2 drugs for therapy. That's not a terrible thing, however. We have lots of combination pills. One of the few things that maybe the pharmaceutical companies have done right is that they've created combination pills that limit the burden for what people have to remember to take every morning. And you know, if you can take 1 pill and get 2 to 3 medicines, that's much better than having to take all 3 at the same time. If your blood pressure is running higher when you first come to see me, if you're in that 180 to 200 range, then we're talking medications from the get-go, because those are levels that we start to become very concerned about strokes, especially in our older population. So we don't want to wait on reducing that blood pressure. We don't want to wait 2 weeks to confirm that reading. You know, at that point, people are having a pretty good idea. They may have started having symptoms, some headache, dizziness, even vision changes, chest pain, shortness of breath, all of those things. So it's time to get the ball rolling and get them treated. So we'll usually at that point you're going to get 2 medicines. Again, we try to do it in that combination therapy, but you know, it depends on the individual.
Right. What about antihistamines? We got everybody with sinus in this area. So, you know, what effect does that have? Are you seeing a lot of that?
Well, clearly, we see a lot of allergies. It's something that I've been afflicted with myself since I was a young child, and people generally want a definitive treatment, and usually the answer is, you know, maybe moving out of Louisiana is the only definitive treatment we have. It's just the nature of the state we live in. But antihistamines can be very effective. They don't tend to have a direct role in blood pressure, but decongestants do. Things like Sudafed or the generics phenylephrine or pseudoephedrine. Those over long periods of time, long periods of use can raise blood pressure. And we tend to try to tell our patients with blood pressure issues to take those cautiously, or at least discuss it with a physician prior to initiating the treatment.
Because I know the reason why I asked that is because I was taking like Allegra D and also other deals, and all of a sudden I never had trouble with my blood pressure. All of a sudden, man, my blood pressure was out of the roof. I went to the doc, and it was like, man, you know, your blood pressure is way out. And I thought I was just all of a sudden with the high blood pressure. And then she asked me, she said, well, what are you taking? And I said, well, I'm taking Legradine. She's like, man, stop. You know?
Well, and that there is a good example of why we encourage people to come back and see us, and we wait until that second visit or more before we diagnose, because medications like that can clearly do it, especially with a lot of the over-the-counter cough and cold preparations. Most of them have some sort of decongestant in it, and you may not read the bottle. All of us have taken NyQuil, and we've probably not paid a whole lot of attention to exact ingredients in it, and that's where we can get into trouble sometimes.
And that's exactly what I think. I was taking NyQuil and I was taking Legradine, so I was double dosing myself with decongestants, and it popped my blood pressure.
The good news is that those effects wear off once you stop them. We see the same kind of thing with people that are using a lot of energy drinks. That's become a very common practice. 5-hour energy, Monsters, Red Bull, all of these things, and there's a large caffeine.
It's the caffeine.
Absolutely. So you can get some false readings or some temporary elevations when people come to the office from this.
And speaking of caffeine, I mean, is there a danger? I mean, we saw in the news, I think it was just as early as a couple of weeks ago, where this kid is suing because the mom is suing because the kid died. I didn't finish reading it, but I don't know if that was a blood pressure deal or what.
Well, it was probably a combination of blood pressure and a heart rate issue. Now, I haven't read about it either. I did hear about it, and I think it was related to the Monster energy drinks as well. And clearly in kids, there's no need for caffeine intake in our children. We all love Cokes and sodas, but children don't need the caffeine intake, and there can be much more harmful effects in them than even adults. But we're not immune to those things either. We don't need caffeine, but our bodies are a little bit more mature and can tolerate at least reasonable doses. But where you get into trouble are the excessive dosages and energy drinks, over-the-counter supplements. We've all seen the mini thins and things that truck drivers used to use and still do to some point. Those crank up the heart rate. They create what we call a tachycardia, and that can be dangerous in anyone, but more so in children where their bodies are still developing, and if they're exerting themselves or exercising or playing around and have overdosed essentially on caffeine, then it can be problematic.
And like you said, it's in Cokes, it's in all these kind of sodas and stuff, everything, so it's real easy if they're taking these energy drinks to kind of OD. And man, they're doing from what I'm seeing, these kids, I mean, they think nothing of drinking 3 or 4 energy drinks.
Absolutely, and there's no restriction on their ability to get those things either.
And I know I drank one time, and I take that back. I had 2. And I thought I was having a heart attack. My heart started beating fast, and started sweating and stuff. And I was like, man, And so to see these kids, and they're not only doing it one time, they're doing it like every day.
Absolutely,
every day.
Morning recess, all of those types of things. So it can definitely be a problem.
Sure. Okay, Doc. Well, we're going to take one more break for our sponsors, and we'll come back and we'll talk a little bit more about high blood pressure. And I think we're also going to hit on the flu.
All right, sounds good.
Okay.